Hey everyone, and welcome to the Deep Dive, where we take a deep dive into some of the most fascinating topics in healthcare.
Absolutely.
And today is no exception. We're diving headfirst into the world of AI and nursing. Now, this topic really hit home for me when we were prepping for this episode. The sheer scale of AI's impact on patient care is just mind-blowing. I mean, it's everywhere. And what's even more exciting is the potential. There's just so much more on the horizon.
You're so right. It's truly remarkable how AI is reshaping the healthcare landscape. What I find particularly fascinating is the connection between the data-driven approaches pioneered by figures like Florence Nightingale and the sophisticated AI systems we have today.
Oh, totally. Florence Nightingale, the OG data nerd.
Yeah.
I love that. But really, let's take a step back for a second and talk about how her work laid the groundwork for the data-driven healthcare we see today. Expert, can you walk us through that?
Absolutely. So Florence Nightingale, beyond being a nursing icon, was a true visionary when it came to data. Back during the Crimean War, she meticulously collected and analyzed data to demonstrate the link between sanitation and patient mortality. Her work was revolutionary for its time.
So basically, she was proving that cleaner hospitals lead to fewer deaths. I mean, it seems like common sense now, but back then that was groundbreaking stuff.
Precisely. Her findings were instrumental in driving changes that led to significant improvements in patient outcomes. It's a perfect example of evidence-based care long before the term even existed.
Wow. And to think now, fast forward to the 21st century, and we have AI stepping into this role of analyzing data to improve patient care. It's like Nightingale's legacy is coming to life in a whole new way.
You're exactly right, and that's where things get really exciting. Think about the ADPIE process: assessment, diagnosis, planning, implementation, evaluation. AI has the potential to supercharge each of these phases.
Now, for our listeners who might need a quick refresher on ADPIE, it's the foundation of the nursing process. But what I think is so cool is how AI can actually amplify each step. Let's break it down, starting with assessment. How does AI fit into that initial phase?
Well, imagine a patient wearing a smartwatch that's constantly collecting data on their heart rate, sleep patterns, and activity levels. AI algorithms can analyze this data in real time, detecting subtle abnormalities that might signal a developing health issue. This allows nurses to intervene much earlier, potentially preventing a serious condition from worsening.
So it's like an early warning system constantly on the lookout for those red flags in the data. That's amazing.
Exactly. And moving on to diagnosis, AI can analyze a patient's medical history lab, results imaging studies, and even genetic information to assist physicians and nurses in making faster and more accurate diagnoses.
Hold on, that sounds super futuristic. Are there any real-world examples of AI being used in diagnosis right now?
Absolutely. There are AI models being developed right now that can predict the likelihood of a patient developing certain conditions like heart disease or diabetes based on their individual risk factors. This information can help nurses and physicians personalize preventative care and make more informed decisions about treatment plans.
Wow, that's incredible. So AI isn't just about crunching numbers. It's about helping us understand individual patients better. It's almost like having a super smart assistant who can process tons of information and identify patterns that we might miss.
That's a great analogy, and it doesn't stop there. AI can also assist in the planning phase of care. Imagine an AI-powered platform that can generate personalized care pathways for patients based on their specific condition and medical history.
So this could potentially save nurses a ton of time and make sure each patient is getting the most appropriate care plan. There's so much potential here. Now, what about implementation? Where does AI fit into that stage?
Implementation is where AI can really start to shine. Imagine AI providing real-time decision support during procedures, offering evidence-based suggestions to nurses and physicians at the point of care. For example, an AI-powered system could help a nurse determine the correct dosage of medication for a patient based on their current vital signs and medical history.
That's incredible. It's like having a super smart assistant right there with you, double-checking everything and providing the most up-to-date information. That could really help reduce errors and improve patient safety.
You're getting it. And finally, we come to evaluation. AI systems can track a patient's progress over time, analyzing data to determine if the interventions are effective and if any adjustments need to be made. This constant feedback loop is essential for ensuring that care plans are always being optimized.
So AI is closing the loop, ensuring that we're learning from the data and making improvements along the way. It's like this continuous cycle of improvement powered by AI. This is amazing. It seems like AI has the potential to touch every aspect of the nursing process.
And we've only just scratched the surface. What we've discussed so far focuses primarily on the direct interaction between healthcare providers and patients. but AI's reach extends far beyond that, impacting the entire healthcare continuum.
Okay, now I'm really intrigued. Tell me more about how AI is being applied across the entire healthcare journey.
Well, let's start with health promotion and prevention. AI can analyze large data sets to identify populations that are at risk for developing certain health conditions.
So instead of waiting for people to get sick, we can use AI to predict who might be at risk and intervene early. That's incredible.
Exactly. Imagine an AI-driven public health tool that identifies individuals at high risk for developing diabetes. This information allows healthcare providers to target those individuals with preventative care strategies like lifestyle counseling and early screenings.
That's a game changer. It's like taking a proactive approach to healthcare rather than just reacting to illness. This is really exciting stuff. What about acute and chronic care? How does AI fit in there?
In acute care settings like hospitals, AI is being used to develop early warning systems that can detect subtle signs of patient deterioration. These systems can analyze a patient's vital signs, lab results, and even their electronic health record to identify those who may be at risk of developing complications.
So it's like having an extra set of eyes constantly monitoring patients and alerting nurses to any potential problems.
Yeah.
That could be life-saving in some cases.
Precisely. And in chronic care management, AI can help patients stay on track with their treatment plans. AI-powered apps can send personalized reminders to take medications, schedule appointments, and even track symptoms. This can be especially helpful for patients managing conditions like diabetes or heart disease.
This sounds like it could be incredibly helpful for patients and really empower them to take a more active role in their own health.
Absolutely. And let's not forget about rehabilitation and recovery. AI is being used to develop robotic exoskeletons that can help patients regain mobility after a stroke or spinal cord injury. These devices use AI algorithms to adapt to the patient's movements, providing customized support and assistance.
Wow. That sounds like something straight out of science fiction.
It really does. And even in end-of-life care, AI can play a role. AI-based tools can be used to predict pain levels in palliative care patients and recommend appropriate interventions to improve their comfort and quality of life.
This is incredible. It seems like AI has the potential to revolutionize how we approach care across the entire spectrum of healthcare.
It certainly does. And just like Florence Nightingale used data to transform healthcare in her time, AI is poised to do the same in our time.
This has been an incredible deep dive so far. We've learned so much about the history of data and nursing the power of AI to enhance the ADPIE process and how AI is being applied across the entire healthcare continuum, but we're just getting started. When we come back, we'll explore even more real-world applications of AI in healthcare and discuss the exciting future of AI-driven nursing. Don't go anywhere.
Welcome back to the deep dive. Before we jump into even more AI applications, I think it's worth emphasizing how these advancements, especially in nursing, really echo Florence Nightingale's vision of data-driven care. It's incredible to see how her legacy continues to inspire innovation in healthcare even today.
Oh, absolutely. It's like we're building on the foundation she laid over a century ago, but with these powerful new tools at our disposal. So we've talked about AI's impact on the nursing process and how it's being used across the healthcare continuum, but I know there's so much more to explore. What other areas of healthcare are being impacted by AI?
Well, one area where AI is making significant strides is in medical imaging. AI algorithms are being trained to analyze medical images like X-rays, CT scans, and MRIs with remarkable accuracy.
So instead of relying solely on human interpretation, we can now have AI assisting in the diagnosis of complex medical conditions. That's a game changer.
Exactly. AI can help radiologists detect subtle abnormalities that might be missed by the human eye, leading to earlier and more accurate diagnoses. In some cases, AI algorithms have even been shown to outperform human experts in identifying certain types of cancers.
Wow, that's pretty mind-blowing. It's like having a second set of expert eyes constantly scanning for any signs of trouble. But does this mean radiologists are going to be replaced by robots?
Not at all. It's more about AI augmenting human expertise. AI can help radiologists analyze images more efficiently, allowing them to focus their time and energy on the most complex cases. It's a partnership, really.
That makes sense. So AI isn't replacing jobs, it's evolving them. And that's something we'll probably see across all areas of healthcare.
Absolutely. AI is changing the way we work, not eliminating the need for skilled healthcare professionals. In fact, I think it will create new opportunities for nurses and physicians to specialize in areas that require uniquely human skills, like empathy, critical thinking, and complex decision-making.
I love that perspective. It's not about AI versus humans. It's about AI and humans working together to provide the best possible care. So what other exciting AI applications are on the horizon?
Well, AI is playing a growing role in drug discovery and development.
Oh, that's interesting. I haven't heard much about that. Tell me more.
Traditionally, drug discovery has been a very lengthy and expensive process, often taking years and billions of dollars to bring a new drug to market. But AI is changing that.
How so?
AI algorithms can analyze massive data sets of molecular structures, biological pathways, and clinical trial data to identify promising drug candidates. This allows researchers to focus their efforts on the most likely targets, significantly accelerating the drug discovery process.
So AI is helping us develop new treatments faster and more efficiently. That's incredible. I mean, think about all the people who could benefit from new therapies for diseases like cancer, Alzheimer's, and so many others.
Exactly. And AI isn't just about finding new drugs, it's also about personalizing treatment.
Personalized medicine. What does that look like in the context of AI?
It's about recognizing that every patient is unique and their response to treatment can vary depending on their genetic makeup, lifestyle, and other factors. AI can help us understand these individual differences and tailor treatments to each patient's specific needs.
That's amazing. So instead of a one-size-fits-all approach, we're moving towards a more personalized approach to healthcare, thanks to AI. It's like AI is helping us unlock the secrets of individual health.
You got it. And AI is also being used to improve patient engagement and adherence to treatment plans.
Oh, that's a huge challenge that a lot of healthcare providers face. Tell me more about how AI is tackling this issue.
AI-powered apps can send personalized reminders to patients, encouraging them to take their medications on time, schedule follow-up appointments, and track their symptoms. These apps can also provide educational materials and support empowering patients to take a more active role in managing their health.
So AI isn't just about fancy algorithms and robots. It's also about improving communication between patients and their healthcare providers.
Absolutely. Effective communication is crucial for good healthcare outcomes, and AI can help bridge that gap by providing patients with the information and support they need to make informed decisions about their health.
I'm really seeing the potential of AI to empower both patients and healthcare providers. We've covered so much ground already, from AI's role in medical imaging and drug discovery to personalized medicine and patient engagement. It's clear that AI is impacting every aspect of the healthcare ecosystem.
And we're really just scratching the surface. As AI technology continues to advance, we can expect even more innovative applications in the years to come. The possibilities are truly limitless.
This is all so fascinating. But with all this talk about AI, it's important to remember that human touch is still essential in healthcare. Technology can do a lot, but it can't replace the empathy, compassion, and critical thinking that nurses and physicians bring to the table.
You're absolutely right. AI is a powerful tool, but it's not meant to replace human healthcare providers. It's about finding the right balance between technology and human interaction.
So what does the future of healthcare look like with AI? What's your vision?
I envision a future where AI and human healthcare providers work side by side, each leveraging their unique strengths to provide the best possible care to patients. It's about collaboration and synergy, not competition.
I love that vision. A future where technology enhances human care and helps us achieve better outcomes for patients. But as we continue to explore the potential of AI in healthcare, it's important that we do so thoughtfully and responsibly.
Absolutely. We need to ensure that AI is used in a way that benefits all patients regardless of their background or socioeconomic status. We need to be mindful of potential biases in algorithms and ensure that AI is used to promote equity and accessibility in healthcare.
Those are really important points. We need to make sure that AI is used to enhance human care, not replace it. We need to be mindful of the ethical implications and ensure that technology is always used in the best interests of patients. I think this has been a really insightful conversation so far. We've covered so much ground and explored the potential of AI to transform healthcare in so many ways. But I'm sure our listeners are eager to hear more about the specific applications of AI in nursing. So when we come back in part 3, we'll dive even deeper into how AI is already being used by nurses and discuss the skills and knowledge nurses will need to thrive in this exciting new era of healthcare. Welcome back to The Deep Dive. We've been on this incredible journey exploring the world of AI in healthcare, and now I'm really excited to zoom in on how AI is specifically changing the game for nurses.
It's important to remember that AI is not just some far-off futuristic concept. It's already woven into nursing practice in really amazing ways.
Exactly, and that's what I want to focus on in this final part of our deep dive. Can you give our listeners some real-world examples of how AI is being used by nurses right now?
Absolutely. Let's start with something as basic as medication administration. AI-powered systems can help nurses double-check dosages, identify potential drug interactions, and even monitor patients for adverse reactions in real time. This can drastically reduce medication errors and really boost patient safety.
Well, that's a huge win for both nurses and patients. I can only imagine how much peace of mind that would give, especially in a fast-paced hospital environment. What other applications are you seeing out there?
Another area where AI is really making a difference is in wound care. AI-powered imaging systems can analyze wounds, assess their severity, and even predict the likelihood of healing complications. This information helps nurses create more effective treatment plans and keep a closer eye on how their patients are progressing.
Wow, that's incredible. It's like having a high-tech assistant helping you make those tough decisions about wound care.
Yeah.
I bet that would be invaluable for nurses, especially those working in specialized areas like wound care clinics or burn units.
Sure. Exactly. And then there's patient monitoring, which is a whole other ballgame. AI-powered systems can analyze vital signs, lab results, and tons of other patient data to catch those early warning signs of deterioration. This helps nurses identify patients who might be at risk of developing complications and step in sooner, potentially preventing a serious event.
It's like having this constant watchful eye, looking for subtle hints that something might be off. Almost like having an extra set of expert eyes watching over your patients 24/7.
You got it. And these are just a few examples. AI is also being used in things like fall prevention, sepsis detection, even mental health assessments. The possibilities are vast and growing every single day.
It's truly remarkable to see how AI is empowering nurses to give even better care to their patients. But I'm sure this new technology also brings some new challenges. How are nurses adapting to this rapidly evolving technological landscape?
Well, one of the biggest hurdles is simply keeping up with the pace of change. New AI tools and technologies are popping up all the time, and it can feel overwhelming for nurses to stay on top of everything.
I can imagine it's like trying to drink from a fire hose of information. So what can nurses do to stay ahead of the curve?
Continuing education is key. Nurses need to actively seek out chances to learn about AI and how it applies to their specific area of practice. This could be attending conferences, taking online courses, or even just reading articles in journals.
That's such an important point. Learning is a lifelong journey, especially in a field as dynamic as healthcare. AI is just another piece of that puzzle, a tool that can help nurses provide better care, but it does require ongoing education and an open mind when it comes to new technologies.
Absolutely. And it's not just about technical knowledge. Nurses also need to sharpen those critical thinking skills to really evaluate the information these AI systems are giving them and use that to make sound clinical judgments.
You're right, we can't blindly trust the algorithms. We have to use our knowledge and experience to interpret the data and make the best choices for our patients. It's really a partnership between human intelligence and artificial intelligence.
Exactly. The future of nursing is about finding that sweet spot between human expertise and the power of AI. And that's what makes it so exciting.
I agree. It's an incredible time to be a nurse. And for any nurses listening who might be feeling a little unsure about AI, remember, this AI is here to support you, not replace you. It's a tool that can enhance your skills and empower you to provide even better care to your patients.
And just like Florence Nightingale embraced data to transform nursing, you too can be a pioneer in using AI to shape the future of healthcare.
That's such a great point. Embrace the change, stay curious, and never stop learning. Well, this has been a truly fascinating deep dive into the world of AI and nursing. We've covered so much ground, from how AI is already changing the landscape to what nurses can do to prepare for this exciting future. We've talked about the amazing potential of AI, its impact on patient care, and the importance of ethical considerations. But most importantly, we've seen how AI is not here to replace nurses, but to empower them to provide even better, more personalized care. So to all our listeners out there, whether you're a seasoned nurse or just starting your journey in healthcare, I hope this deep dive has inspired you to embrace the possibilities of AI.
And don't forget, for those of you who want to dig even deeper into the specific AI applications we've discussed, be sure to download the PDF that goes along with this episode. It's full of extra resources and real-world examples you can check out.
Thanks for joining us on the Deep Dive. Until next time, keep learning, keep innovating, and keep caring.